Multi-hazards, all about protecting communities.
Hello, dear listeners. Here's another episode of the Multi-Hazards podcast. It's where we take a deep dive into issues in emergency management, climate change adaptation, security, etc. And ultimately, our objective is protecting communities. So welcome, everyone. I'm host Vin Nelson. Today, I'm delighted to have Regina Phelps, President of Emergency Management and Safety Solutions Incorporated, based out of San Francisco, California, the USA. She is an internationally recognized expert in the field of crisis and continuity management and exercise design. Since 1982, she has provided consultation and speaking services to clients in 4 continents. She is a frequent speaker at international continuity conferences such as those of the Disaster Recovery Journal, DRJ, the International Association of Emergency Managers, IAEM, and the World Conference on Disaster Management. Ms. Phelps is consistently rated one of the top-rated speakers in her field and is known for her approachable and entertaining speaking style and her ability to take complex topics and break them into easily digestible and understandable nuggets. Experts and novices consistently say that they always learn something new from her presentations. So Ms. Phelps' latest book is Cyber Breach: What If Your Defenses Fail? Designing an exercise to map a ready strategy. Her other books are Emergency Management Exercises, From Response to Recovery, and the Companion Instructor's Guide. All 3 are available on the Amazon website. Now, it's my tradition here at the Multi-Hazards podcast, because I have deep respect for the First Nations people on whose land I podcast, here in the suburbs of Vancouver, British Columbia, Canada, to say a territorial acknowledgement. The text is from Kwantlen Polytechnic University, or KPU, near my home. Here it is. We work, study, and live in a region south of the Fraser River, which overlaps with the unceded traditional and ancestral lands of the Kwantlen, Musqueam, Katzie, Semiahmoo, Tsawwassen, Kikite, and Quiquetlam peoples. These are the names of various First Nations groups around me here in Greater Vancouver, here on the west coast of Canada. Now, without further ado, let's get to the interview. Welcome, everybody, to Multi-Hazards, and today we have a special guest, Regina Phelps. Now, she is just down the coast from me. I'm in Vancouver, Canada, and she's down in, I believe it's San Francisco, California. Is that right, Regina?
That's exactly right.
Okay, great. Now, I have to admit, literally, I'm not joking. This morning, I'm starting this interview with fear and trembling. Well, number one, because I dropped my microphone and I thought I almost broke my $250 microphone at the last minute. Things happen. And secondly, is last night before I slept, I watched an ABC YouTube video on what is happening with COVID-19 in your precious country, Regina. I know a lot of people like to hate on the United States, but as somebody who's read a lot of history and a lot of stuff, I say we need everybody. We love everybody. And I think your country's precious no matter what's going on. And precious people are dying and getting sick from COVID-19. Precious people are also losing their jobs and wondering where their next paycheck is coming from. Mm-hmm. And here where I am in Vancouver, it's like, oh, we're on, I don't know, is it phase 3? And we're kind of like, oh, we're just easing out of this and the second wave might come. So we're not in that same situation. So that was my little rambling intro. So Regina, just welcome to the podcast. I'm really happy that you're here today.
Thank you. It's a great pleasure to be with you.
And I also heard a podcast, I think it was in March, you did it for Bus Stop. Is that right?
Yeah.
So that was mid-March. So I'm really eager to hear what you have to say. Now it's nearing the end of June, and we're a few months into this pandemic, and it's kind of gone in directions that I think nobody has foreseen. So I'm just wondering right now, it sounds like you're a real expert too on this, and I'm just wondering, you are going to talk about planning phases. So where exactly are we now?
Yeah, first of all, it's a great question, Ben. So, and just by way of introduction, I've been a crisis manager for 38 years, but our firm has done pandemic planning for 22 years. So I am an expert in this, and I'm actually living what I've been talking about for the last 22 years, which frankly, I would prefer not to, but here we are, right?
Yeah, exactly.
And thank you for that, your comments about the United States, because I'll just talk about that just for a second. The United States is in a really awful situation. We've had a real problem right from the beginning with a lack of recognition of how serious the virus was, some significant missteps within the CDC, our Center for Disease Control, a variety of political missteps, I think, and lack of leadership at a variety of levels across the United States. And now we're kind of plagued with a pandemic fatigue, if you were, where people are just tired of it and want to get on with their life. But what I really want to speak with you about today is that this is our life. And that's the first thing that people need to deeply understand. This is not going away anytime soon. And I mean maybe a year or two or longer. And I think we need to get over this idea that it's going to go away and we can get back to our normal life, because life is never going to be what it was before, and it's going to be different. And we just have to embrace that in whatever way we can find comfort in. But here in the United States, the issue about masks and the virus in itself has become a real political football, if you will, with all sides of the political spectrum having different opinions. And so it's made it even more awkward for Americans. And so I appreciate your concern for us, because we need all the help we can get. So having said that, I wanted to start, first of all, with a frame of how to hold where we are in the pandemic. So there are a classic set of 5 phases of a pandemic that were created by the World Health Organization, but they're not helpful at all trying to live through this. And so what we did in our firm is we took the experience that we have of all of these years and created what we think is a more viable way of looking at the pandemic as far as phases. And so let me just talk through them. There are 7 phases all total. The first one is planning. So I'm going to start at the beginning so we can hold this frame for where we should have been on December 31st, 2019. In the planning phase of a pandemic, what that is about preparing the basic pandemic plans and all the tools that you would need in order to respond. So depending on what your background is, that would include not only a pandemic plan, but it would include crisis management, emergency response, business continuity, technology recovery, and crisis communications. Because in a pandemic, you actually need all of those things, very functional and current, and people trained and exercised so they can respond. So for your listeners, that's what we should have all had in place before December 31st, 2019. Mm-hmm. And so then the second phase of our pandemic is awareness. And so awareness is when you first became aware of it, and then you begin to assess as to whether it could potentially impact you and your business. So our awareness, I saw the first alert on actually a great site that I followed for years called promed.com. Promed.com is actually a part of Harvard. The official address is promedmail, mail.org. And essentially it's a site that's curated by Harvard. And they follow diseases all over the world, not just that affect humans, but mammals and plants and everything else. And so in all of those disease notices on December 31st, there was a comment about a strange pneumonia in Wuhan, China, which makes anybody that follows pandemics a little nervous. So for us, we were aware of it really starting about January 2nd, and our first client activated on January 10th. Now, Vin, when did you first really become aware of the pandemic and where it could be a problem? When was your awareness?
You're saying British Columbians, so where I live, or me, myself?
Yeah, but maybe both of you.
Okay. It became a concern because we have so many Chinese people living here in Vancouver, and I believe local governments were afraid that people would come back from China, from like visiting for the Chinese New Year the Lunar New Year in
February.
January, February.
Yeah,
so
February.
They were worried about people coming back and bringing it. And I think a couple did, but later on it played out that actually most of our cases were coming from Europe and from Ontario, Quebec in Eastern Canada. And myself, I knew from, I think, within a few days of it breaking out in Wuhan and getting like out there, because I'm kind of connected with the Asian communities here. So they were well aware of it, and they were wearing their masks already before all the other non-Asians.
Right. Yeah, so the Lunar Year this year was actually the end of January through the second week of February. And so, yes, so you were actually early on the scale. Most of our clients, unless they had a lot of work in Asia, weren't really paying attention to this. And so we sent out our first notice to clients in the middle of January saying, okay, this is a great time. Get out that pandemic plan of yours. Let's take a look at it. Look at your crisis management plan. Look at your business continuity plan. And I think people just thought we were cute and patted us on the head. But yes, indeed, we kept following it. So the second phase of our pandemic planning is actually assessment. So again, that varied depending awareness and assessment, and that really depended on again people's connection, if you will. The third part of our phase is actually what's called activation. And so that's when you actually stood up your crisis management processes, activated possibly your business continuity plans, really activated your pandemic plan, and began to work what you had. If you didn't have a lot of those things, right away, companies realized, oh my gosh, I need to get on this. And so we saw this incredible surge of demand for people asking us for pandemic plans, which was so intense for about 45 days, because once we really got into the throes of the pandemic, and really I'd say by the second or third week of March, it was almost too late to develop a pandemic plan. At that point, it was just trying to develop things on the fly for companies who hadn't thought about it. The fourth part of our planning process is what we call reevaluation. Now, let me describe what I mean by that. In reevaluation, now, of course, in a crisis, you're constantly reevaluating things, and we see that all the time after all of our years of practice. Whether it's a flood or a tornado or an active shooter, you're constantly reevaluating. But the kind of reevaluation that you're doing in this pandemic is very different. And that's because we're talking about something that's got not only impact that we have never even imagined before, but secondarily is length of duration. So the reevaluation phase of this planning process is continuous. You're constantly reevaluating where you are now, and you're looking at this very long road in front of you, and you're evaluating things constantly. And you're doing that as a company in two areas. One is strategically, but also tactically. So on the strategic side of the house, we started seeing things that executives were doing right away at the strategic level of a company, things related to, maybe we're going to postpone building a new building, or we're going to stop leasing so much space, or we're going to stop doing certain activities, or we're going to peel off part of our business or sell something, or even start to acquire things because the buying opportunities were there. So that's what those guys were thinking about. On the tactics, it was basically how to keep running the business when people had never imagined ever that everybody would go to remote work almost overnight. So in your area, then, was that, did you see a lot of movement where people were then suddenly deploying people to home?
I work for a local college, and they have emergency management plans for all kinds of things. But I think here in Canada, we're sort of like the Scandinavians, kind of halfway there, where we trust our government a little bit more.
Well, that's good.
At least most people. Some of them are like on bridges protesting, jail the prime minister. But most of us, I think, we trust our government at the federal and provincial and local level a little bit more, maybe, perhaps. I'm not saying we're better than Americans, but I'm just saying that we've had this history, I think, of a little bit more trust. So we looked to the Canadian and BC, British Columbia governments to give guidance. And then we just followed whatever they started saying. So they start closing down, and then we look at the universities. Are they closing down? The businesses? So it was kind of like a domino effect, and it happened in a week. And this was mid-March. And
isn't it amazing that if you would have said to somebody, we're going to have an event where all of a sudden everybody's going to have to work from home for months on end. People would have looked at you like you had horns coming out of your head. And also, I think people would never want to have all of their employees working from home because, gosh, we don't know what they're doing and we don't know if they're working and so on. And all of a sudden, all of that went out the window and we just all jumped in the pool together. And I think it's created such a change, which we'll talk about more in a minute. But I think when you're looking at all of a sudden deploying to a total different strategy of working, initially for the first few weeks, many of our clients were trying to get their legs, right? Their legs underneath them from this new remote work situation. And so because of that, they were constantly reevaluating what can we keep doing? What should we stop doing, at least for the short term? Because we want to make sure that we're able to at least get the most mission critical activities done. So our clients were constantly reevaluating, how is it working? What are we doing? What are we missing? And so on. So it was really taking your business continuity plans and really blowing them up into ways that people had never thought. Then starting really for us really about the end of March, I'm in San Francisco. We've been in lockdown, and we're still pretty locked down, since March 13th. And so at that point, we get to the fifth phase of our planning, which has essentially two parts to it. One is what we call cocooning, and the second is really about reentry planning. And by cocooning, what we mean is that in particular, for about 6 weeks, what we saw is our clients were hunkered down, really just trying to keep the animal alive, right? You've shrunk down all the things that you're doing. You're doing the most mission critical things, and you're just kind of keeping everything going. Nothing's different. Nothing's new. Nothing's changing. The idea is you don't want to introduce anything that could possibly change how effective you are in your work strategy. So this whole cocooning idea was really critical to sort of make sure that we could all kind of keep moving along. And simultaneously, we started to extensively work with our clients probably about the third or fourth week of March until right now, all on what we call reentry planning. We don't call it returning to work because I don't know about you, but I've been working harder than I've ever worked my entire life, so I'm not returning to work.
Mm-hmm.
The
This
idea
means
is
going to the office.
Yes, exactly. How do you reenter? And so the whole idea of reentry has really been challenging because initially my clients were really anxious to get back. And then when they started to really deeply understand what it would take to go back, what the risks are to go back, that their idea of reentry really changed. And so one of the questions we ask everybody is, if it is working for you being at home and you can actually do the vast majority of your mission critical activities and run your business, why are you going back now? Why are you going back now? Why are you willing to risk that? Because when you actually first go home from the office, when we all fled the offices and went to our remote work locations at home, there was a significant business interruption for most companies. And then they finally got their legs underneath them and things pretty much started to work pretty well. But then what happens when you go back? There's another business interruption because now you got to get resituated and learn all the new protocols and blah, blah, blah. And then if you have an outbreak again, now you have to go back home and start all over. And so the question really is, if it's working right now, why would you risk the health of your employees to make them get on public transport or other ways of getting into the office and then having everybody together and potentially creating a situation where you could have an outbreak that could really impact a large number of your staff? And so most of the white collar clients that we work with, and that's probably 80% of our clients, opted to pretty much, for the most part, stay home. So in your situation, what you're seeing in Vancouver, what are you seeing there as far as, are people flocking back into the office or are they staying home, or what's your sense of that?
I think slowly they're starting to go back to the office, but to be honest with you, people who are working in more like hands-on laboring type of jobs,
Yep.
They never stopped working, most of them. They've
Of course.
been just going all along, and we look at them and say, oh, well, they're not really like congregating, but I think they're also putting themselves at risk, even at the construction site or electricians or whatever they're doing. It's also risky.
Right.
But office workers, yeah, they're working from home and they're just keeping on.
Yep. Yeah. And I think what I've seen is not only our experience, you're describing one very similar in Canada. I've seen that in many of our clients around the world where for the most part, they are taking a more modest approach, which I think, frankly, especially here in the U.S., is very smart, because what we're seeing is this incredible uptick in cases, which is going to make the work environment even a little bit more dicey. So this idea of reentry planning is very important, and it needs to be something that everybody does, because, again, this is going to be with us for several years. So, at some point you will send some people back, and we could spend then hours talking about all the things you need to think about with reentry. But the thing I just want to leave your listeners with is that when you look at reentry planning, you ultimately should really never have more than 50% of your staff back in the office at any one time. And most of our clients plan to have probably no more than 25 or 30 for the very foreseeable future. And the ones that are going back are either those individuals who cannot work successfully at home, either because of something they really need in the office that's not easily transported into a home environment, or perhaps they have a home situation which, maybe a lot of kids or a lot of other people in the home, and it's not feasible to work productively at home. Or perhaps they just want to be in the office. But most of them have really limited that to, at this point, no more than 10%, and with a forward-looking glance of probably no more than 25, but never more than 50. So just have your listeners sort of keep that in the back of their mind.
Right. And can I just insert something here?
Sure.
It's not over because we want it to be over or we will it to be over. It's like me having cancer in my body, saying, there's no cancer. I've been putting up with this for a few months. I'm tired of it. So it's gone. It's not gone until the doctor tells me it's gone. Mm-hmm. So I don't know why it's like reopening this, doing that. Why? Because you're tired? Or is it because we've conquered COVID-19? We haven't conquered it.
Right.
So that's my little beef with just like, and of course the economic fallout is devastating, and people, they might even die from it, or there might be really bad things happen from it, but it's kind of not an either or situation. We need to work on both. Right. What would you say about that?
Oh, absolutely. I mean, I think the thing about the denial factor that you're describing is huge, and the idea of I want my life back. Well, frankly, I'd like my life back too, but it is not going to happen just because I'm pounding on the desk and sobbing, right? So I think what I've really encouraged my clients to really look at is, again, reimagining things and just understanding this is our life. I mean, that's I said at the very beginning, this is our life. This is what we're going to be doing. And no amount of science is going to make that go away in any time soon. Let me talk about the two other things because I want to be sensitive of our time. But so the sixth phase we have is actually conducting your reentry, and then obviously observing and watching what's going on, because when people go back, you're going to potentially have cases. You may have additional spread, and really keeping an eye on what's going on as far as the next potential wave. And I'll talk more about that in a second. And then the last phase, which I think is really important and unusual in any kind of planning process, which is what we call reinvention. And what I would say to you is that anybody who is living through this pandemic needs to look at the pandemic as really an opportunity for reinvention, whether it's a business or yourself personally or your family. The idea is that we're going through this transformative experience. And I think we have a unique opportunity to ask ourselves as we are moving through it, what would we do differently? How would we maybe change your personal life, or maybe change how you do your business? And I will tell you that because of the success of remote work, you're going to see a transformation in American offices that is going to be something you would have never expected. The tremendous movement of either a lot of remote work or some sort of hybrid model where you have half the time people working from home or longer, few times coming into the office, or maybe completely working from home. I think you're going to see changes that you would have never seen before as we reinvent ourselves. So my point about really calling that out in the phase is to say, take the opportunity to think about how could we do things differently? How could we continue to do the things we're doing that are working, and then modify things accordingly? But I think what will happen after we do this for a year or two or longer, I want to emphasize that we will actually have transformed our society in many ways, whether we actually wanted to do this or not. But that's really what's going to be one of the key things that comes out of this. So I hope that we are thinking about transforming ourselves in our society, in our businesses, in our own personal lives into something that's possibly better than we were before the pandemic. We have that opportunity.
Can I just insert a question here? It seems to me that, there's a lot of people who work in offices, they're working remotely, then there are the other people on construction sites, there are people maybe working in restaurants and the customers have to pick up at the door. But there's a lot of people who've been just sitting and watching Netflix for 3 months.
Yep.
And we're thinking, so what are we going to do about them? Just send them checks to survive? Is there a way where we can just get all these huge swaths of people working again, but social distancing, not going out and building a new bridge and infecting each other that way, but maybe to go on site in a way that they're 100% doing a great job physical distancing, or teach more people how to work from home. Like there needs to be almost like a whole reinvention of the economy for that group of people. And that's millions of people.
Yeah, I totally agree. And I, first of all, you're never going to make things 100% safe. First of all, we need to understand that. And I think what we need to do is think about this issue of reinvention. So you're seeing things in the United States that people would have never talked about before, like universal income and so on. For those jobs that are not ones that can easily be reconfigured in a safe way, how can we actually continue to make sure that people are supported in some way? Can they be taught new skills? I mean, when I talk about reinvention, then I'm talking about we need to really look at society as a whole, because some of these jobs are not going to be as safe as we would like them, especially with still the lack of personal protective equipment in the United States. And so I think I don't have any answers for this one. I wish I did. But I think there are a lot of smart people that are really beginning to see that this has got a very long, long, long road ahead of us. And so we need to find creative ways to make sure that people stay whole as we go through this. And that's a huge, huge deal.
Right. And one thing that everybody has to remember right now, in your country especially, you've got the Reds and the Blues fighting each other on social media and other places. And in Canada, we do have this polarization between left and right, conservative and liberal on the other side. And it gets vicious. But if we really do the right thing, maybe when we get out of COVID-19, this polarization will not exist anymore. We will learn to, maybe there'll be like side A and side B and side C, but it's not going to be like it is now where we're at each other's throats, calling each other, libtard and COVIDiot and this and that. We're going to be, I hope, more respectful and work together, because we have to all work together, regardless of our political background or beliefs, to survive.
Right.
So.
Right. I mean, I couldn't agree with you more. I think what that's going to take, though, is some sort of reckoning. And I think in the United States, what might be part of our reckoning, to be honest with you, is, and this is going to sound awful, but I think if you look right now, what's happening in the United States is the states that are really under siege are many of the states that have not wanted to wear masks, have not wanted to social distance, have also believed that this is a hoax and so on. And I think what's going to happen is this spreads into those communities and people start to die, that perhaps that will be some of a kind of an awareness, if you will. I don't know. But we need some leadership that would really bring us together. And I'm thinking about, the idea of the Martin Luther King, I Have a Dream, or the idea of different leaders across history that have been able to bring people together, whether it was Churchill in World War II or Roosevelt or people like that literally can bring the society together to realize that we're all in this together versus, our individual rights, which is a real plague of American society, I think.
I think that it's going to happen. Like, sorry for being an optimist here, but I believe it's going to happen because people love their families. They love their communities. They love grandma and grandpa. And, I don't like my mask. I don't like lockdown because I can't get a haircut. People are going to get over it. And they're going to look and see, with grandma dying, that's a big deal. Yeah. That's a motivation to change.
I would think so. It would certainly motivate me if I was in that other camp of not believing this.
Yeah, that is so awesome, Regina. Now, I don't want to take up too much of your time, but I just wonder if you have one last message for the listeners.
Well, thank you for that. So I think we've been saying it all the way along, but my real message is this, is to really, please, I beg you, I get on my knees, please take this as serious as you possibly can. Really mask up, physically distance, wash your hands a lot, don't touch your face, and find ways that you can actually interact with people that you love, that are close to you, that are not dangerous. So whether you create your own little bubble with other people, but please, especially when around people that might be older, immunosuppressed, have comorbidities, be very respectful of the distance that you place between you and them to ensure that everyone in any relationship, in any transaction that you have, remains safe. And I wish good health to all of your listeners and yourself.
Well, thank you so much, Regina, for being here. It's nice to hear somebody with a real expertise in pandemics giving us some clear thoughts. So thank you so much for being here today, Regina.
Thank you. I appreciate you, Ven. Thank you so much.
All right. Have a great week and weekend.
Thank you.
There it is. That's my interview with Regina Phelps. Thank you again, Regina, for being a guest here at the Multi-Hazards Podcast. So a little disclaimer here I add to the end of each and every episode these days, and it is, this podcast is meant to be educational and does not try to offer legal, medical, or other specific advice unless otherwise noted. Also, the opinions expressed here do not necessarily reflect those of the organizations that the host, that's me, or guests are part of. So, here as I wrap up this interview, I thank all of you precious listeners for tuning in. I hope you learned something. Stay safe out there. And stay tuned for more. This is Vin Nelson wishing you the best on your journey of surviving and thriving with all that life throws at you. Cheers to you all. Peace out.